Hello, hello. We are doing another sneak peek into Crucial Concepts Bootcamp. So those of you that are here are wanting to see what it's actually like before you dive in. So hello, and I'm just messing with my microphone here real quick. I'll be taking you inside that in just a moment. I'll wait for some people to arrive, and then there will be a replay. Obviously, it'll be available later as soon as we're done here. So hello, let me know who you are. I see somebody's here. Pop in the comments, say hello, and we will get rolling here in just a bit. We're going to do a sneak peek inside Bootcamp. So a lot of students have questions about Bootcamp, and it's often just easier to answer everything if I take you inside the program, okay? So welcome, welcome. I'm going to put the link here if you want to check it out as well. HTTPS. I always forget what that is. And then it's learn.straightanursing.com. I'm just putting the URL in the comments so you guys can see it. Okay. All right, you guys. So I'm going to share my screen and take you inside Bootcamp. I just put the link in the comments, so you should be able to see that in just a moment. And then I want you to pop in the comments. Let me know if you have specific questions about Bootcamp. Okay, it's on sale right now, and the sale is ending in a few days on the 10th. So that's the promo code that you want to use if you want to get the 20% off and the bonuses. Okay, so there's the URL as well. Okay, so let's pop in and take you on kind of a behind the scenes of Bootcamp. So I'm going to share my screen. And when you first log into Bootcamp, and give me a thumbs up if you guys can hear me, okay? Just want to make sure that my microphone is working and all is well. So when you first log in to Bootcamp, you're going to see all of the modules. So what we do basically throughout this whole bootcamp is it's a nursing school prep course. It's going to give you those core foundation concepts that will help you be successful in nursing school. So in this first module, it's just me explaining how to use the program, so I don't need to show you that. But in module 2, this one is all about how to talk like a nurse. And the reason for this is because you got to be able to talk the talk before you can walk the walk, right? So in this module, I take you through medical abbreviations, medical terms, so that you can learn basically how to speak this new language that you're going to be hearing almost constantly from day one. And it's a lot to learn. It can be overwhelming, but if you have that little bit of background, it makes things so much more seamless, that transition, and a lot easier. So we dive into medical abbreviations and terms. And then lesson 2 is about communication methods, and SBAR is how we communicate in the clinical setting to convey information about our patients, to call the physician and express a concern, to give report at the end of our shift, etc. So I talk about that, and if we click into that, nursing communication and terms. And I believe this one has some downloads. I wanted to show you guys that. So you can see right there, many of the lessons come with these downloads. And let me see if I can just real quick show you what that looks like. So yeah, here we go. Let me just move it. Oh, can I move it over so you guys can see? So yeah, there's a lot of downloads that go with the bootcamp, and I just wanted to give you a feel for what they look like. Okay, this one's about the autonomic nervous system, and we'll talk about that in just a moment. Okay, so we're back here, and we're looking at our SBAR. Okay, so then we'll go back to our categories, and in module 3, this one's all about thinking like a nurse. So one of the ways that students kind of struggle, especially initially, is with transitioning. Basically, once you think like a nurse, you'll never be able to not think like a nurse. It's just a different way of looking at scenarios, situations, problems, and solutions. and thinking through about 50 different factors to come to the safest, most best choice for the patient. So that's a lot to learn. That's a lot to assimilate. And students who are able to make this transition have a lot easier time in nursing school and are a lot more successful. So I want you to have an introduction to that before classes start, so that you're not kind of starting out behind, just starting out actually ahead. So we dive into clinical judgment and what this means, and an approach to developing clinical judgment. And then this whole lesson right here, the 6 skills of clinical judgment. This is a brand new lesson. I recently updated all of boot camp. And so in this lesson, I really dove into the clinical judgment measurement model, which is how your school will be evaluating that you are competent. And this is how the new NCLEX is written. It's written against these 6 skills of clinical judgment. So you might as well understand that concept from the very beginning. And what are those 6 essential skills? So I introduce you to that in this module. And yes, the lessons are all video based. As you can see here, there's a play button right there. Okay, so that is that part of module 3. Other things in module 3 include talking about the nursing process, talking about the Tanner model, the Tanner clinical judgment model. A lot of schools use this. It's awesome. It's a fantastic model for really learning from your clinical experiences and being able to then apply that to future scenarios. The Tanner model is how you basically accelerate your clinical learning, your clinical decision making, your clinical judgment. I introduce you to nursing diagnoses and what those are, how to write them, how to understand them. We talk about Patricia Benner and the whole, there's a whole novice to expert pathway that you'll have to know very well, and the role of the nurse. So that's in that section. That's module 3. And then module 4 is about how to act like a nurse. In this module, I take you through some basics about vital signs, and we dive into more than just what the normals and abnormal numbers are, because you could probably learn that in about 30 minutes, right? It's a little bit more of the clinical significance of what if the respiratory rate is too high, or what if the heart rate is too low? Why do we care? And a little bit about what we do to address it. So that's what that is. We also dive into subjective versus objective, because students struggle with this. I know I certainly did. I make it super simple. By the time you go through this short lesson, you'll have that down solid. We also talk about care plans and how to tackle those. This is a really key skill, something students often spend a lot of time trying to figure out how to do it. If you already have an introduction, you're going to be great at this from the very beginning. And then in these videos right here, you see all of these kind of like topics. This is me just kind of talking to you one-on-one through the most common questions students ask about clinical, so you know what to expect. And then in module 5, calculate like a nurse. This is where I teach you how to do dosage calculations step by step. So if you came to the math anxiety presentation that I did a few days ago, we talk about that more here in this module. And then we go through all the basics, the foundations of dosage calculations. And then this right here, the 4 questions, I call this the secret sauce, okay? This is my secret sauce for being successful with dosage calculations, because they're not just math problems, they are puzzles. And if you can solve the puzzle, you're going to be great at dosage calculations. A lot of students look at them as just math problems, and that's where they really struggle with these. So if you go through the 4 questions, you're going to think critically through them and look at them as problems and puzzles to be solved, and do a lot better with them. And then we go from single conversions to multiple conversions and slowly ramp up the difficulty while we ramp up your confidence and your independence. Then we get into medications that are dosed by time, medications dosed by weight, and then weight and time. So as you can see, we start at the very beginning and then we go all the way to the most complex type of questions. So that's the general overview. We also dive into some other types of questions like dilution questions, percent weight loss, etc. I'm also going to share with you all the ways that your instructors are going to try to trick you so that you will be untrickable when you're doing your dosage calculations. And then this lesson on critical thinking with dosage calculations is probably the key. Again, I would add this to that secret sauce to just making it almost impossible for you to come up with the wrong answer if you follow these steps. So that is that module there. And then in module 6, this is how to learn like a nurse, basically studying smarter in nursing school using the Latte Method, which is a systematic way of categorizing the information that you need to study. It also helps you with that how to think like a nurse component. So the Latte Method is great for focusing in on just what you need to know, okay? And then how to take notes. Students are often overwhelmed and not really sure how to take notes, and then aren't sure how to utilize their notes after they've taken them to actually study. So I dive into that here. We talk about using tables to organize similar but different information. And again, more information about critical thinking because that is such a key skill, okay? And then we'll dive into module 7 and I'll show you what that entails. Module 7 is really to give you a heads up about the NCLEX style questions and how to approach those, because all of your nursing school exams are going to be written in this format. And as the NCLEX evolves and changes, it's not just going to be multiple choice questions. Yes, those are in and of themselves kind of their own beast as far as NCLEX style questions go, because many times all the answers will look pretty good, or though it's written in such a way that it's kind of hard to decipher. But there's also all these other types of questions. So in this first lesson, I just introduce you to what those might be. There could be drag and drops, fill in the blanks, images where you click on the appropriate area of the image to find the answer. So that when you go and sit down to take an NCLEX style question in school, you're not blindsided by, oh, I thought this was just going to be all multiple choice. It may not be. And then in these subsequent lessons, I take you through kind of like the different themes. NCLEX style questions are going to be kind of following some key themes: life and death, patient safety, teaching, the nursing process, prioritizing, etc. And within each of these types of themes, if you look at the question and you can identify, okay, this looks like it's asking me about a prioritizing situation, I give you tips on how to think through and answer that type of question. So that's what we cover in this Test Like a Nurse module. Oh, and then I don't want to miss page 2 because there's some great stuff on here. In this lesson, I think it's like 17 tips for actually taking those NCLEX style exams, and including the NCLEX as well. There's also a test day strategy, and we select all that apply questions because they tend to make students really nervous, and hopefully after you go through this lesson, they don't make you as nervous, okay? So that is module 7 of boot camp. Module 8 is where we dive into the key topics that you would need to use from anatomy and physiology. These are the ones that I use every day that I work at the bedside. So we'll look at fluids, we'll look at electrolytes, we'll look at acid-base balance, blood pressure regulation. This right here is probably the one I use the most. This one and fluids, probably the ones I use the most. And then these last two, the RAS pathway and the autonomic nervous system, are really great, not only for understanding physiology and what's going on with your patient, but a lot of medications either act on this pathway, inhibit this pathway, and then the autonomic nervous system. Lots of medications are parasympathomimetics, sympathomimetics, and if you have a good solid grasp of the A and S, you kind of have a leg up on that portion of pharmacology, which can be a pretty significant stressor for students. Pharmacology, I love pharmacology, but a lot of students find it difficult. And then the ninth module, this one's probably the most fun. This is where we get super, super organized for school. I show you how to set up your digital files for max efficiency, your syllabus, your binders. If you're still using paper, okay, we talk about how to organize that paper. I know a lot of students, including me, a lot of people just trying to go more paperless. We talk about being kind of paperless with the master list, and then how to use good notes and notability. That can also help you use less paper, have your notes digitized, and then planning your life is all about using a planner, whether it's a paper planner, digital planner, to really prioritize and do time management very well. One of the key skills for nursing students is seriously time management. And then in the final module, this is a brand new module that I added when we updated the course, is all about writing for nursing school. You will do a lot of writing, papers, case studies, discussion board posts, things like that. For your papers and your case studies and even discussion board posts, they do need to be researched. They do need to be referenced. One of the easiest things that I discovered this in graduate school, actually. I wish I'd had it as an undergrad. It's Zotero. It's a free tool that is just absolutely fantastic for organizing your research, your bibliographies. It puts things into APA format, your in-text citations, your bibliography at the end. It's fantastic. So I take you into Zotero to show you how to use it. And then I show you how to do some basic research. And I use Google Scholar for this because I realize a lot of students may not have access to a university library. Maybe you're going to a smaller school, a private college that doesn't have that access. So you may be doing your research just online. So Google Scholar and PubMed, you can use the tips that I provide here on how to find good, reputable research articles to use in your writing. And then basically a quick lesson on how to write an organized and compelling paper. So we talk about that in that lesson. So that is the overview of the boot camp. So if you came in on the, midway through, this replay will be up. And then I did one a few days ago as well. You can check that out. It is on sale right now, you guys. That's why I wanted to show it to you now, because the sale ends on January 10th. It's always available, but I do run sales 3 times a year. This is the winter sale. There will be one in April. There will be one in July, and then we start again on Black Friday. So that's the promo code for the sale. You get 20% off. There's some free bonuses. There's an electrolyte study guide that's really great. As well as a couple other things. So that is the URL. I also put it in the comments. If you have any questions about Bootcamp, you can ask them here now. You can reply to this video later. I will see the comments. You can send me a DM. I'm happy to share any information to help you make that decision. If you want to see some more information about it, when you go to that URL, that's right there at the bottom of the screen, you can see some testimonials from other students, and also, let me see where that is. There it is. Again, like an overview of what is in each of the modules. So it is on sale right now. So normally it's $83. So if you go here, let me just pop in the coupon code. It's going to bring it down to $66.40. So that is the winter sale that's happening right now. So thank you for checking it out. And if you have any other questions, please don't hesitate to reach out. I will be around most of the day because I'm writing some stuff for the podcast. So I'll be at my computer. So if you have a question, pop it in the comments, send me a DM. Happy to help. Okay. Jim is working on module 5, and it's super helpful with understanding dosages. Oh, awesome, Jim. Yeah, I'm especially proud of module 5. I love teaching medication math to students, and because I was that student that was really kind of math phobic. I don't know if you came to the math anxiety talk the other day, but I was really, I had serious math anxiety. And now that I teach math is just kind of amazing. But when you use this system, it makes it not scary at all. It makes it actually kind of fun because I love doing puzzles. And now that I realize they're not just math problems, they're actual puzzles. They're a moment in time, you, the patient, a situation, you got to figure out what to do. It really does. The questions that I have in my boot camp, and there's over 100 practice questions, really do kind of put you in a scenario so that you can start also like that process of learning how to think like a nurse and the types of decisions that nurses make. Okay. Hello. And it's no, you have continued access to it. It doesn't end after 3 to 5 months. No. Somebody asked this the other day and I was like, when I retire, but that's a long way off. Okay. I promise you'll be out of nursing school by then. Okay. So yeah, no, it doesn't expire like a few months from now or a year from now. A lot of students will register, go through it before classes start, and then revisit it in between semesters for like a refresher, which is a really great thing to do. Okay. You're very welcome. You're very welcome. And you can send me a message if you have any other questions. Okay. So thank you so much, you guys. And I will be around if you have questions. Have a fantastic day. And I think that's it. Okay. Have a great, what day is it? Saturday. Have a great Saturday, everybody. Bye.